Good evening, ladies and gentlemen. I am Dr. Balasubramanian. On behalf of the Indian Society of Gastroenterology Tamil Nadu chapter and delving specialties, I have great pleasure in inviting you for this unique international online symposium. And it is really an international one. I see so many people from abroad. And the topic is also seems to be new, the symposium on premedication in upper GI endoscopy and diagnosis of early gastric cancer. And with this word, I pass it on to Dr. K. R. Furness for me to conduct the proceedings. Over to you, sir.
Good evening, everybody. I would like to thank the Delvin Pharma and the Tamil Nadu chapter of gastroenterology for having given me the opportunity to take part in this international symposium. And as you all know, we all face this, when you do upper endoscopy, we face this foaming of the mucosa. So which really interferes with the sort of clear view of the mucosa, we may miss the lesions. So in the era of image enhanced endoscopy, the clear view is most important to diagnose cancers early, not only malignant lesions, even benign lesions. So we need to prepare the GI tract, upper GI tract before the procedure. So far, of course, we have not been addressing this seriously. Now, currently, I think we need to address to have a clear diagnosis of mostly early cancers. And we now have a combination of the simethicone and also the N-acetylcysteine from the Delvin Pharma. And it has been sort of a lot of research has been done. And regarding that, we have a lot of international we have about four international speakers. Apart from that, we have experts from India also to sort of discuss about this problem. And among the international experts, because we have the Western perspective, the Eastern perspective, and also the Indian perspective. So without wasting much time, I shall hand over for the start of the meeting with the first speaker and the chairpersons. Can I hand over to Baldus or Mr. Manivanan to start the proceedings?
Yes, sir. Sir, thank you so much. Dr. Ubaldas, sir.
Yes, sir. We call upon the chairpersons, Dr. Rajesh Puri and Zagir, to take over further proceedings. I request Dr. Rajesh Puri to take over.
Thank you, Delvin Pharma, and I would like to welcome our international speakers as well as the chairperson and the Indian faculty. Without wasting the time, I would like to invite Professor Norio Udo, and he's the mentor for image enhancement technique and the little bit of the ESD which I have learned from him. And I invite him to deliver a lecture, a thorough gentleman, and who's a director of Cancer Institute, I forgot the name. And I welcome Professor Norio Udo to give his comments about pre-medication in upper GI endoscopy and diagnosis of early GI cancer.
Thank you for kind introduction, and thank you for kind invitation for this web conference. So my topic and the presentation today is a bit simple, but I want to share some information to discuss. So role of premedication and other essential quality indicator for quality upper GI endoscopy in Japanese practice. So in Japanese guideline, the process of early gastric cancer consists of a risk stratification and detection of abnormal finding and differentiation, staging, and surveillance. And among them, of course, detection is very important. Without detection, we cannot cut the lesion or paste the lesion or something. But initially, we have to detect a lesion in an early stage. So in Japanese guideline, it is recommended to use mucolytic or deforming agent to improve mucosal visibility to detect early gastric cancer. And spending sufficient time to observe the whole stomach is also strongly recommended. And the systematic observation method to avoid missing area is also strongly recommended. So recently, several randomized control trials are published the usefulness of image-enhanced endoscopy to detect early lesion. But I think this type of benefit is not only achieved by use of such kind of technology, but also good preparation for detection of the mucosal abnormality. So actually, for colonic study, it's also shown that the one systematic review of and meta-analysis of randomized control trial indicated that the detection of adenoma is best in NBI with best bowel preparation. So actually, preparation is very important to detect subtle mucosal lesions. For example, if the bubble or mucus is covered the surface, we can miss this type of lesion. And also, if the mucus or bubble is covered the surface of mucosa, even we apply chromo or NBI or image enhanced technology, we cannot appreciate a mucosal characteristic finding of the mucosa. So in order to solve such kind of problem, in Japanese practice, we usually use pronase, mucolytic agents, and simeticon, gascon, kind of simeticon to anti-foaming agents. But I heard that outside Japan, there's pronase is not available. So instead of pronase, you can use acetylcysteine mixture. And this is a probably standard combination of mucolytic agent and anti-foaming agents. But my best friend, Ken Xiao, when he went to Myanmar, he found that the preparation was very bad. So he wants to improve the preparation for upper GI endoscopy. But he found that in Myanmar, acetylcysteine was $2. $2 sounds not so expensive, but he found that in Myanmar, one EGD costs $3. So $2 for any acetylcysteine is very expensive. So he changed the preparation and preparation for the food and eating, and also premedication for EGD. So in the past, they strictly prohibit drinking and eating before the endoscopy, almost one day before the endoscopy. However, he found that the mucus or bubble is very sticky and very adhere to the mucosal surface and very difficult to wash even with the water flushing. So he allowed the patients to drink water, clear liquid until before the endoscopy, and then prescribe 4 drops of simeticon diluted in 200 ml water before 30 minutes of examination. And he found that the preparation becomes very good. So actually, I think this is the latest meta-analysis show that pooled mucolytic agent improve mucosal visibility, but only simeticon also improve mucosal visibility. And with use of combination of simeticon and N-acetylcysteine, mucosal visibility improvement is almost the same to the only simeticon. And the use of 130 mg and administration 20 minutes before the procedure was the best for mucosal visibility cleansing. And once we had 2 visitors, Srihari will be presented his own data, but another Indian visitor was Ashutosh. And once I heard his preparation, so he said that he also allowed patients to drink coconut water 1 hour before endoscopy, and then 15 drops of simeticone with 200 ml water before 30 minutes of examination. So he also found that this really improved the visibility of the mucosa. And recently he found that about 8 early gastric cancer cases in this 6 months. And then I asked him to present his experience in a Japanese Congress. And at that time, Kenshi Yao was a chair, and he was really impressed by his presentation. So for allowing the drinking of water, actually recently Japanese handbook or manuals for screening examination really allow to drink water, clear water, 1 hour before endoscopy. I think this type of water drinking can soften the mucus and then improve mucosal visibility without extra cost of additional agents. So for optimal time for EGD, one Singapore data showed that the doctor who spend longer than 7 minutes likely to miss early gastric cancer. And Japanese also similar data analysis shows that the threshold time in Japan is 5 minutes. So my friend in Philippines said that this difference of 2 minutes can be a different preparation. So he found that usually outside Japan, sometimes he spend 1 minute or 2 minutes for clearing the gastric mucosa. So maybe good preparation can reduce the time of examination. And of course, even though we clearing the mucosa, systematic observation method is very important to avoid a missing area for detection. So in summary, use of mucolytic and deforming agent is strongly recommended with appropriate time and systematic observation. So optimal preparation is a basic of quality upper GI examination, and it maximizes any measure of endoscopic observation, such as white light and the use of IEE or something like that. And only simeticone with enough amount of water may work similarly to N-acetylcysteine combination with N-acetylcysteine. And of course, even though you have very preparation and technique, basic knowledge is also important. Okay, thank you for kind attention.
Thank you, Professor Noria Vedu, for giving an excellent presentation and giving the insight into the role of pre-medication for early detection of the cancer. Now, I will like to invite the next speaker, by Dr. Jahir. Dr. Jahir?
Yes, Dr. Rajesh.
Yeah.
Dr. Norio, very nice and elucidate presentation of the pre-medication. I think there remain certain questions unanswered. One is we did see that only simeticone is sufficient for adequate preparation, and N-acetylcysteine may not be required because it's not only costlier, but the pre-mix preparation is difficult to get at all the places. So just for the fact that there are a couple of studies which say that the mixture of N-acetylcysteine, a mucolytic agent, and simeticone is superior to simeticone alone, the defoaming agent. So what's your take on that?
So maybe probably combination is better than only simeticone, but the probably benefit of simeticone is much larger compared to just a pure water or something. So I just want to emphasize, and according to, comparing with the cost, regarding to the cost or additional cost or something. So I think enough amount of, and also most of the comparative study, they use simeticon with a small amount of water. But I mentioned that the large amount of like a 100 ml or 200 ml, it also works better. So I think I want to emphasize the cost effectiveness or something, effectiveness of simeticon along with sufficient amount of water.
So Professor Norio, my feeling is it is not only the pre-medication, but it is examining the stomach from all the angles, examining, at least giving the proper time, and the chart which you have shown, I think is a 24 area you need to examine. That is one of the very important thing. Yes. Second thing which comes in my mind is just to ask the question, like when we give the rectal enema to the patient, in a patient of ulcerative colitis, we tell the patient to prone, to the left lateral, to the right lateral. When you take simethicone with the N-acetylcysteine and you drink, how we ensure that the entire stomach lining is away from the mucus? What is the take home on that, number one? And second question is the water, because many of the people wash the stomach with the jet water and that produces a lot of bubble. So the 2 points I need a clarification. Number one, while drinking and doing after half an hour, is there any studies available which says the entire stomach, right from the fundus, body, cardia, and antrum is free of mucus? And second is regarding the flushing the stomach wall with water. Which water should be used? Should we use water jet or should we use the syringe? Any message you want to give?
So probably, but if the stomach is distended with the air, maybe 200 ml water is stay in some part. But usually before insertion of the scope, stomach is collapsed. So I think 200 ml of water is usually soak most of the part of the mucosa. And sometimes we found that only antrum is still some bubble or mucus is remain. So probably it is left lateral position. It is opposite side of gravity. But
so do you? Sorry, please go ahead.
Yeah. So
do you use? Sorry, please go ahead.
So I think 200 ml. So it's enough. Almost 80% of the mucosa. I don't know the exact data with the study, but I think most of the area can be removed.
Okay. The second question is: do you use the mucolytic agent in the antrum while doing endoscopy, or you use the plain water to clean the part of the? Because many of the time tumor has a mucus associated with that, and we need to clean it. So do you clean with the diluted solution or do you clean with the water?
Usually we use simeticone diluted water and not in a water jet because sometimes crystallize block the nozzle. So I usually dilute simeticone into the water and then use syringe flushing.
How much simeticone you use and how much water you use?
Usually only a few drops for 100 or 200 ml. So only small amount. It's a kind of supernatant. I don't know the English name, but only small amount can effectively remove the bubble.
One more question which come in my mind: when you do the chromoendoscopy, so simeticone followed by chromoendoscopy, simeticone plus N-acetylcysteine and chromoendoscopy, there is any interaction between the agents? Is there any interaction, or is a neutral agent which has no interaction with the contrast agent we use to delineate the early gastric cancer or the early esophageal cancer?
So it's very important question. So usually simeticone water does not have some chemical reaction between indigo carmine or Lugo solution. So But very important thing, as I show in my scheme, if the mucosal surface covered with mucus, dye does not really reach to the mucosal surface. So we cannot see the mucosal contrast and the topography of the mucosa. And also Lugol, even Lugol solution does not really reach to the epithelium. So initially we have to flush out all the mucus as much as possible with a Simeticon and then apply dye so that you can achieve the best effect of the image enhancement. NBI is the same.
And for esophagus?
Yeah, same. Lugol solution. We usually wash the mucus with a Simeticon water and then apply the dye.
Because in the esophagus,
Same
there's a
principle.
gravity dependent. When you drink the water, it immediately goes to the stomach. So
So-
while doing the esophageal examination, you do with the Simeticon diluted water and extra over the drinking. Is that right?
So somewhat similar to underwater procedure. So we usually flush under the distended lumen with a flushing, and then after that we apply dye and then suction all the air and collapse the lumen so that all mucosa was attached with the solution. So that is very important. So and if you really collapse the lumen, usually solution retain in that area. So if you insufflate the water, if you sufflate the air, water push the dye or solution away to the stomach.
And one funny question, it just came in my mind. People use soda also. The drinking soda. The drinking soda.
I don't know. Soda means
The soda which we
Soda pop?
milk in the alcohol or in the soda water.
I haven't seen
Carbonated
the literature.
water.
Carbonated
Carbonated.
water. Carbonated water.
Carbonated water. I don't know. Usually, pronase, it's better to mix with sodium bicarbonate, but I don't know the effect of the carbonated water. I don't know.
Yeah, Dr. Vedo, Dr. Vikas Singla here. Excellent presentation. Can I ask a question? Regarding the effect of Simethicone on the bile. Sometime after gastrojejunostomy, there is a lot of bile reflux. So any preparation for that in that scenario?
Maybe I don't have a clear answer to that question, but basically I understand that Simeticone works as an anti-bubble. So it just prevent the bubbling. So even there's some bile contained juice, I think it also works. Yeah.
Thank you.